On a Thanksgiving call with the troops, the president delivering welcome and unexpected news.
The vaccines are being delivered literally. It'll start next week and the week after. And it'll hit the frontline workers and seniors and doctors, nurses, a lot of people.
Unexpected since the leading candidate, Pfizer, is so far the only manufacturer seeking emergency use authorization for its COVID-19 vaccine. And the FDA review of that authorization request isn't until December 10th. Key word there, review.
That's thousands of pages of data that they have to review between now and then in advance of that meeting. So this is really quite a tedious, long process that's starting to get underway. And while they will be trying to do that as efficiently as possible, mid to late December is really the earliest that this could get done by.
NYU Langone infectious disease physician Celine Gounder is on President-elect Joe Biden's COVID-19 advisory board, a task force charged with putting together the president-elect's plan to combat the pandemic, plans that have thus far not had the benefit of seeing the Trump administration's coronavirus blueprint.
I can't see that the first group of people, which will be those frontline healthcare workers, getting vaccine before the new year.
Dr. Anthony Santella is a professor of public health at Hofstra University.
And then you're talking about the people who have underlying health conditions as the second group, and then probably young children and people who work in K-12 education, childcare workers. Then maybe people who have, like work in colleges and public transportation, et cetera. And then the last group will be the American public.
My guess is the general public will have access sometime in the late spring, early summer.
Dr. Jessica Justman is an infectious disease expert with Columbia University Medical Center. She says development of a vaccine and emergency approval is one thing, but the logistics in getting it to where it's needed when it's available is another.
We need to be patient and let the logistics experts figure out how to get these vaccines, some of which, like Pfizer and Moderna, require ultra cold freezers. And not every part of the U.S. has an ultra cold freezer.
The president yesterday more concerned with who gets the credit for the vaccine. Speaking of Joe Biden.
Don't let him take credit for the vaccines, because the vaccines were me, and I pushed people harder than they've ever been pushed before.
Politicians of either political party are not the ones that develop vaccines. Vaccines are developed by scientists and doctors and public health workers. So this is really not a win for either political party.
Now, CNN reporting tonight that the CDC's Advisory Committee for Immunization Practices has scheduled an emergency meeting for Tuesday to vote on the very first people to get a coronavirus vaccine once one gets emergency authorization. So we're still a ways off, Damson and Corey.